name is Anil, best take of antibiotic. Doctor, we take pleasure to introduce our Regen-D 150 for quick and careless healing. Doctor, to treat diabetes, foot ulcers, venous ulcers, and that sort. So please recommend Regen-D 150, doctor. Regen-D 150 recommended human epidermal growth factor is a regeneration therapy for faster wound healing. As per given data and epidemiology, global and India scenario. India is the second largest diabetic populated country in the world, and 25% of diabetic patients develop DFU, out of which 20% patients follow lower limb gets amputated. Further, pressure ulcers and venous leg ulcers. Prevalence pattern is significant in India compared to global scenario. Doctor, wish to draw your attention on graph 5-year mortality rates of DFU or DFU related amputations compared to other diseases is quite significant. Doctor, as you know, doctor, amputation largely impacts quality of life and life expectancy. Doctor, role of EGF in wound healing is best known to you. EGF induces rehabilitations, angiogenesis, and collagen production. Hence, doctor, request you to prescribe Regen-D 150, a regeneration therapy for faster wound healing in diabetic foot ulcers, pressure ulcers, including bed sores and venous leg ulcers. Doctor, there are established efficacy and safety of Regen-D 150 in several clinical trials. Wish to draw your attention on following graph. One DFU phase 3 study adapted from Dr. Vishwanath V 2006 shows average healing time. Test group Regen-D 150 9 weeks, control group placebo 15 weeks. Two DFU PMS study and phase 3 trial adapted from Mohan VK 2007 shows the average wound healing in patients was 86% and the average wound healing time was 4.8 weeks. Doctor, no adverse events were reported in patients during the PMS study. 3 bed sores, pressure ulcers, phase 3 study adapted from phase 3 clinical trial reported in bed sores. Average time to compare healing, test group Regen-D 150 40 days, control group 79 days. 4 venous leg ulcers, phase 3 study adapted from phase 3 clinical training chronic leg ulcers. Average time to clinical complete healing. Test group Regen-D 150 40 days, control group 95 days. And efficacy of Regen-D 150 in healing of DFU at biochemical and molecular levels. Punch bypass and histological analysis revealed the role of Regen-D 150 in healing of diabetic foot ulcers versus placebo. Doctor, Regen-D 150 group has shown significant increase in collagen content, number of fibroblasts in matrix and angiogenesis. Regen-D 150 group has shown decrease in MMP9 expression and healing time 50% as compared to placebo. There was no evidence of any pre-malignant or carcinogenic changes in the histological evaluation of the wound lesion. Doctor, some are photographs depicting quick healing after application of Regen-D 150. One healing time 13 weeks. Dr. Sharda Pandisi, Diabetic Research Center, Nagpur. Condition diabetic foot ulcer. Ulcer size 12 square centimeters. 2 healing time 5 weeks. Dr. V. Vishwanath, MVC Hospital, Chennai. Condition diabetic foot ulcers. Ulcer size 3.80 square centimeters. 3 healing time 8 weeks. Dr. Ajay Yadav, Gangaram Hospital, New Delhi. Condition venous leg ulcers. Doctor, long-term surveillance study for safety. A 2-year follow-up study was conducted to assess the long-term safety of Regen-D 150 in all subjects enrolled in this phase 3 clinical trial. Outcome is no incident of recurrence of ulcers from the subject using Regen-D 150 post-study period. None of the subjects observed a detection pre-malignant or malignation lesion. Thus, Dr. Regen-D 150 proves its clinical safety and efficacy in accelerating healing of DFUs. Sir, we request you to look at some of the publications. 1. A phase 3 study to evaluate the safety and efficacy of recombinant human epidermal growth factor in healing DFU wounds 2006. 2. Recombinant human epidermal growth factor effect on healing of diabetic foot ulcers. Diabetes research and clinical practice Elsevier publications. Doctor, efficacy of recombinant human epidermal growth factor in healing diabetic foot ulcers, a hospital-based randomized controlled trial. Doctor, the International Journal of Lower Extremity Bones, there are below reference for your Persia. Doctor, now Regen-D 150 is stable at room temperature. Regen-D 150 is an international patent brand. Doctor, as you have seen all the features, benefits, clinical trial reports and publications and references shall request you for regular prescription of Regen-D 150. Doctor, Regen-D 150 is available in 15 grams and 7.5 grams. Doctor, so please prescribe Regen-D 150. Doctor, thank you for valuable time. Thank you very much, doctors.